Hi, I'm Dr. Gunnarsson with TMJ in Sleep Therapy Center of Utah, and I'm here with Mindy, our myofunctional therapist. And today's topic is on breathing through our nose and how it is your superpower. We thought of doing this at this time because it is beginning to be cold and flu season out there, and we want to talk about how breathing through your nose can help you fight off colds.
Right. Our nose is designed specifically for breathing. It has turbinates in there that helps to swirl the air to give it more time in our nose before it actually enters our lungs. And what that's going to do is it's going to hydrate the air, it's going to warm the air, and it's going to filter the air that we're breathing in. So our nose is designed to help clean that air. And the hydration and warming is really important to prevent inflammation from happening in our delicate lung tissues. And that's the first line of defense that our nose has. But our tissues also produce a chemical called nitric oxide, the tissues in our sinuses. Nitric oxide is a really important chemical in vasodilation, but it is also something that is a disinfectant. When the viruses and bacteria pass over it, it kills them. So it's not just a bactericidal, it is a virucidal as well.
So how many times do you think you breathe? Just breathing, whether it's mouth or nose, per day?
That's a good question.
That's a good question.
We breathe a lot more often than we swallow.
It's estimated that we breathe 20,000 times a day. And actually, what's interesting is studies have shown that breathing is going up. The rate at which we're breathing is increasing. And that is because more and more people are breathing through their mouths instead of their noses. Now, that doesn't make you a bad person because you're breathing through your mouth. It's just a fact that we went through this whole COVID thing of wearing masks and we felt like we couldn't get enough air, so we were breathing through our mouths instead of through our noses. And we developed that bad habit over that year, 2 years of whatever we were doing with the masks.
Right.
Of breathing through our mouths. And now we need to return to breathing through our noses, and it's just not happening. We've grown accustomed to breathing through our mouths, so not through our noses. And it's interesting because we treat TMJ and sleep in the office. I mean, those are the big things, and craniofacial pain. And I frequently get this real questioning look on people's faces when I assign them to you, myofunctional therapy, to learn how to breathe properly through their noses when we're addressing their jaw joint. And it's interesting because when you aren't breathing through your nose or can't breathe through your nose at night, it causes you to clench. And it's that clenching that causes damage to the jaw joint itself. And so we feel that it's very important that we, in order to solve your jaw joint issue, that we solve the why, which is the clenching, which is caused by mouth breathing and not nasal breathing.
Right.
And so we come back to this where we have Mindy teach you different techniques to develop that subconscious way of breathing through our noses instead of through our mouths.
Right. There's a lot of bad habits with mouth breathing because it puts the tongue out of position as well, which weakens the muscles of the tongue. So a lot of those breathing exercises that we work on, we learn correct tongue posture so that the tongue can be then strengthened and supporting nasal breathing. Surprisingly, our tongue is really important in helping us to nasal breathe because our mouth is a much larger pathway than our nostrils are. Yeah. And if our tongue is out of position and our lips part, that air is going to go the path of least resistance, which is a wider opening of our throat, but it's not the healthiest way for us to breathe. That's why tongue posture is really important as well to support that nasal breathing, and that also can affect the jaw. If your tongue is out of position with those weak muscles, because then your jaw has to work harder and differently in order to maintain that open mouth breathing, which is a dysfunctional breathing.
So I have a question for you, and I know we're going to get a lot of people who are watch this on YouTube. They watch how to mouth tape because they feel like the only way to get them to breathe through their noses is to mouth tape. And what do you think about people who are self-mouth taping? Is there any concern about self-mouth taping? Is it really doing the full job, or is it just a panacea for them to think that they're doing something proactive?
That's a really good question. Mouth taping is beneficial in that it forces them to breathe through their nose because they can't open their mouth. But the root of the problem is likely with their tongue. So, are they doing any type of tongue training to keep their tongue in correct position, to strengthen the muscles, for it to turn into a good habit of nasal breathing as opposed to having to remember to put on the mouth tape in order to mouth breathe?
Mm.
So, I mean, if it's supporting the nasal breathing, yay. But again, it's the Band-Aid. We want to fix the source of the problem.
Yeah. What really happens when you are ready to go to bed at night, you've got allergies because you have pets at home, you can't breathe through your nose, and you decide that you want a mouth tape. I think that your body's going to go into a big panic mode because it's not getting any airflow now. So it's very important that if you decide that you want a mouth tape, which isn't a bad thing, but to have it done with the direction of a professional like a myofunctional therapist, because they can help guide you, especially with getting images of your nasal airway, your mouth, your throat, which helps guide them in the direction of how to best help you in your breathing through your nose.
Right. Because there are a lot of cases where we see people who have a deviated septum that is significant enough that it's actually blocking off a portion of their nasal breathing airway, making it difficult for them to breathe. So even if they are managing their allergies or not, a lot of people don't manage their allergies, but it makes it that much more difficult. And if they're taping their mouth and they have a deviated septum, then they're going to be suffocating themselves.
Mm.
So we definitely do make sure that we're addressing mouth tape the correct way and also using the correct or safest type of mouth tape for all circumstances.
Yeah, I think I get people using painter's tape, masking tape, electrical tape, anything that will stick really, really good to the face and close that mouth. And so you do need to be careful. There are special tapes made specifically for mouth taping. One of the big things that we haven't talked about is enlarged turbinates. There are so many people today with enlarged turbinates, and those are they're part of your nose or part of your nasal airway. They look like little sausages that run down the each side of your nose.
Yeah.
And when they're swollen, they block the nasal breathing, the nasal airway. And so we have very specific techniques that we use in our office to help you do nasal clearing at night, to get those areas nice and clear so that you can breathe easier at night. So during that mouth taping, during the breathing, that you're actually breathing through your nose instead of through your mouth. And so that you're not clenching, not grinding your teeth. It just is an overall healthier lifestyle. And we haven't even started talking about how breathing through your nose helps in sport and helps the brain and does help oxygenate the blood much, much better. I mean, we talked about that nitric gas and how that nitric gas, when we breathe it in through our nose, actually helps with oxygenating the blood in our bloodstream. And it helps with dilation of blood vessels. And what's interesting is not only does it do that, but it helps kill the bacteria and the viruses that we breathe in through our nose. And it's every time we go like that, it sucks that nitric gases out of our maxillary sinuses into our nasal cavity and helps kill the bacteria and viruses and oxygenate and cause vasodilation, which helps you overall in sports activities. And it's no wonder your coach is always telling you, breathe through your nose, not through your mouth, especially for runners, because you can run so much better. You can outperform all others when you are breathing through your nose instead of through your mouth. It takes some learning, some adjusting, and some adapting, because I know that when we get patients in our office that it is hard for them to breathe through their noses. They're just not used to doing it. And they do the exercises and they practice, and they have found that when they follow exactly what we tell them to do, that they have great success in whether it's their jaw joint or sleep. They're sleeping so much better. They sleep sounder.
Or just their quality of breath in general. I've had people tell me that it just feels like they can fill their lungs with air, where before they just felt like they were just partially breathing. They felt like they had to work harder in order to fully expand their lungs. So just the quality of breath in general improves by breathing through your nose.
So just know, we want you to be healthier. And that's why we do these podcasts. That's why we're talking about nasal breathing, especially during the cold season that's coming up. And so if you caught on, if you're breathing through your nose, you're killing the bacteria and the viruses that are out there before they enter into your system. And that allows you to live a healthier lifestyle and get less sick over this whole winter period. So we appreciate you joining us today in talking about nasal breathing. It's a very important topic, and we take it very seriously in our office. And we appreciate you joining us today. If you haven't, follow us, like us on Facebook and Instagram, and we'll see you next time.